Can an algorithm help clinicians decide when to transfuse platelets in the neonatal ICU? What's the latest research on heart transplantation in children? What are the emerging indications for GLP-1 receptor agonists? This and much more on today's JAMA Editor's Summary. Hello, and welcome to our listeners around the world. Today is Friday, September 19th, 2025. I'm Dr. Kirsten Bibbins-Domingo, the editor-in-chief of JAMA and the JAMA Network. For this episode, I'm joined by JAMA Deputy Editor, Dr. Preeti Malani. Hello, Preeti.
Hi, Kirsten. Let's start off with some interesting pediatric content. Dr. van der Staaij and colleagues developed a prediction model for prophylactic platelet transfusion for premature infants with severe thrombocytopenia, which is defined as platelet counts less than 50. Platelet transfusions may reduce the risk of major bleeding in this population. However, recent studies have actually shown a weak or absent association between platelet count and bleeding. These investigators evaluated two hypothetical transfusion strategies using a large cohort of infants less than 34 weeks gestation with severe thrombocytopenia. They created a prediction model that considered if patients received a platelet transfusion within 6 hours or no platelet transfusion for 3 days. The primary outcome was 3-day risk of major bleeding or mortality. Using this international multi-center cohort and a separate validation cohort, the authors found that prophylactic platelet transfusion tended to indicate reduced risk of bleeding or mortality at the lowest pre-transfusion platelet counts and concluded that the algorithm performed well in a validation cohort. They also noted that the findings show substantial variation in benefit and harm of platelet transfusion for severe thrombocytopenia, depending on the overall clinical picture.
We have an editorial by Dr. Metcalf and colleagues that notes that the findings of this study support the concept of a threshold curve, where above certain platelet counts, the projected benefit of platelets tends to be outweighed by risk, rather than just an absence of effect.
We heard from JAMA Deputy Editor and Pediatrician, Dr. Liu, who was the handling editor for this trial. Dr. Liu explained that this study is interesting because it's a step towards personalized medicine in this challenging clinical situation. Many factors aside from only the platelet count influence whether a preterm infant with low platelets will benefit from a transfusion, and this study helps lay the foundation for a decision support tool to make better individualized treatment decisions.
There's another interesting study published this week, which is the Teammate randomized clinical trial by Dr. Almond and colleagues. The median survival for children after heart transplantation is limited to 15 years, without notable improvements in long-term mortality. This trial looked at different approaches to immunosuppression and the risk of rejection and other adverse events in children undergoing heart transplantation. It's a multi-center, open-label trial that included more than 200 patients who were alive 6 months after their transplant. The participants were randomly assigned to receive Everolimus and low-dose Tacrolimus or standard-dose Tacrolimus and mycophenolate mofetil for 30 months. The authors measured the major adverse transplant event score at 30 months. While the Everolimus regimen appeared safe, the authors found no difference between the two regimens in preventing cellular rejection, cardiac allograft vasculopathy, and chronic kidney disease. However, Everolimus may be associated with improved kidney function and less CMV infection.
JAMA also published 2 research letters this week. Measles cases are on the rise this year. Dr. Ahmadi and colleagues report on a case series documenting a surveillance method to help track measles cases in the U.S. using 2025 data. The authors developed an infrastructure to collect publicly available measles reports at the county level that could inform public health measures and model outbreak risk. Then we circle back to pediatric transplants, this time pediatric kidney transplantation and donor-derived EBV infection, which can greatly increase the risk of post-transplant lymphoproliferative disorder, or PTLD. Dr. Potluri and colleagues used data from the Organ Procurement and Transplantation Network to review EBV infections from donors among pediatric kidney transplant recipients. They found that less than 14% of EBV seronegative children in this cohort received an EBV seronegative kidney. They call for policies that would increase the likelihood of EBV seronegative children receiving an EBV seronegative donor kidney.
There are some thought-provoking viewpoints this week. Dr. McKenzie and colleagues explain that investments for the development of new therapies are not always geared towards diseases with the highest burden. They propose goals to help close this gap, like strengthening public-private partnerships. There's a viewpoint on women's health by Dr. Temkin, which advocates for investment in high-quality healthcare for women as an important component of tackling chronic disease. And Dr. Jane and colleagues in their viewpoint support expanding opportunities for dual training in medicine and humanities research.
JAMA published 2 additional opinion pieces this week, a perspective and an editorial. Glucagon-like peptide-1, or GLP-1 medications are a hot topic here at JAMA. Doctors Gonzalez-Rayan and Drucker provide up-to-date information on emerging GLP-1 medicines, indications, and more in their perspective article. And the inaugural JAMA editorial fellows reflect on their experience and discuss ways to expand pathways at major medical journals for early career researchers.
The JAMA clinical review this week is a very helpful topic: superficial vein thrombosis. Dr. Piazza and colleagues summarize current evidence about diagnosis and management of this common condition. Make sure to tune in to the JAMA Clinical Review's podcast for more. Co-author Dr. Bicdelli spoke about pathophysiology, risk factors, diagnosis, and treatment of superficial vein thrombosis with JAMA Deputy Editor Dr. Mary McDermott. Here's a clip from the interview.
Superficial vein thrombosis happens when there is a thrombus, a clot, within the superficial veins in the body. And the reason it's important is twofold. Number one, it causes local symptoms and discomfort for the patient, but also it might be a marker of risk for something more serious and recurrent thromboembolic events.
Refresh your skin exam knowledge with this week's clinical challenge, which is about a 2-month-old with pink papules and plaques.
This week's patient page is on endometriosis. It does a great job explaining this condition, which affects up to 10% of women of reproductive age.
And in this week's episode of JAMA Plus AI Conversations, Dr. Michael Howell, Chief Clinical Officer at Google, discusses whether AI models are getting better at figuring out safety guardrails in healthcare. In this discussion with JAMA Plus AI Editor-in-Chief, Dr. Roy Perlis, Dr. Howell shares this very interesting statistic.
One of the other things that I didn't understand until I came to Google is how creative human beings are. I know that sounds silly, but if you look at what people come to Google search and search for, it turns out that 15% of what gets typed into the search box every day has never been typed in before. It's the first time that it's ever been typed in. That makes it a really interesting space to think about with the intersection of things that by definition can't be in your training data because people are saying them literally for the first time in human history. And how do you give safe responses to that? Obviously, there are many things that are way across the line that you don't want your models to say. And it's an ongoing issue with a huge amount of safety research around.
And before we wrap up, keep in mind the latest articles in clinical medicine, biomedical research, public health, and health policy written and researched by our outstanding JAMA Medical News team at jamamedicalnews.com, or you can click on the link in the show notes.
Thanks, Preeti, and thank you for tuning in to hear what's new at JAMA this week. These highlights were brought to you by Dr. Preeti Malani and me, Dr. Kirsten Bibbins-Domingo. This episode was produced by Daniel Musisi and Dr. Krista Roberts at the JAMA Network. A link to this JAMA content can be found in the episode's show notes. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.